Kellie Copeland, and I'm the Executive Director of NARAL Pro-Choice Ohio. And typically when I speak at a press event, I'm talking about access to women's reproductive health care, everything from prenatal care to contraception to safe and legal abortion. But I wanted to talk to you about a different aspect of the Affordable Care Act today as as the manager of a small nonprofit, very similar to a small business. Someone who has to make payroll every week, who has to cover the health insurance premiums for my employees. Several years ago, we hired a gentleman to work for us. As a women's rights organization, for the most part, we have had women working for our organization, and so this was a little bit new. And I was shocked when I got the insurance bill and found out that the female employee I had of similar age, I'd been paying about $500 a month for her insurance. His insurance was $175 a month. That was over $300 a month difference, almost $4,000 a year. And what occurred to me was how unfair that was. And as a small business owner, that was a disincentive to me, frankly, to hire women, because then I knew that every woman I hired cost me $4,000 more per year than any man that I hired. And when you think about the economy that we've been going through, we want people to have a level playing field, an equal opportunity to get the jobs that they're most qualified for. And when you're applying, particularly in a small business environment, as a woman, I think sometimes you have to wonder, did I lose out to a man because his insurance is cheaper than mine, because it's less expensive to employ him than it is me? That's not the American way, and the Affordable Care Act will change that. Sadly, one of the things that I have learned as I have researched that and been looking into the Affordable Care Act is that our experience was not unique. Innovation Ohio and, I'm checking my notes, the National Women's Law Center, they did the research on this to see if our experience was typical, and it was. And what they found was that the typical 40-year-old Ohio woman buying individual policy pays anywhere between 20 and 50% more for her insurance. That's absolutely the experience that we had. 60% of insurance plans sold in Ohio charge more to non-smoking women than to men who smoke. So clearly, it's beyond just the smoking issue. It's the gender was a bigger factor than smoking. In addition to driving up costs for individual policy holders, gender ratings increase group insurance rates for the entire company. And it is sorry, I'm just stumbling on this one. In addition to driving up costs for individual policy holders, it also drives up the costs for group plans for small businesses and nonprofits like mine. And it makes it more difficult, particularly for those organizations who employ more women than men. Maybe agencies that work in nursing or agencies that help with teaching, in professions that we know that women tend to hold more than men. They're paying more for their insurance simply because of their gender. Let's see.
That's good, Kelly.
Okay, 14 states have banned this practice. 17 more have for individual policies. 17 more have banned it for group policies. The Affordable Care Act will ban it across the country. And that is what women in this country need to be competitive in this economy and to have a fair chance at the jobs that they're qualified to do.